Hi, my name is Abby Burton, and I am a pediatric occupational therapist at Big Blue Canopy in Blue Ash, Ohio. I have been doing pediatric occupational therapy for almost 8 years now, and I absolutely love my job. Occupational therapists help individuals do the things they want, need, and are expected to do through participation in meaningful occupations. As OTs, it is our job to make sure that our patients can live their lives to the fullest in spite of any various challenges, conditions, or disabilities that they might have. Meaningful occupations in pediatrics include play, learning, socialization, sleeping, self-care skills, and so much more. As OTs, we can provide both rehabilitative and habilitative services. Rehabilitative services help individuals regain skills after an injury, impairment, or illness. Habilitative services help individuals keep, learn, or improve a variety of skills for their increased independence. We have both rehabilitative and habilitative patients in pediatric OT. However, the majority of patients I see are seen for habilitative services. Common diagnoses that we treat in pediatric occupational therapy include ADHD, anxiety, autism, cerebral palsy, coordination disorders, learning disabilities, spina bifida, sensory processing disorder, Down syndrome, and so much more. As OTs, we can help your child with a variety of skills. Our scope of practice is extensive. There's almost nothing that we can't help with. So if you have a concern about your child and they're not able to do something, reach out. We'd be happy to see how we can help. We can help with things such as dressing skills, feeding skills, emotional regulation, executive functioning, self-regulation, handwriting, and so much more. Our OT sessions at Big Blue Canopy Therapy are going to be lots of fun. We might start in the sensory motor gym where your child might be, climbing the rock wall or standing on a platform swing while throwing beanbags at a target or playing on the zip line. But we're doing these skills so that we can build underlying foundational skills such as hand-eye coordination, core strengthening, motor planning, dynamic standing balance, so that then we can help increase their independence in other areas. That might be handwriting, that might be feeding, it might be dressing skills. So they're learning through play so it doesn't feel like they're working. At Big Blue Canopy, all of your OT sessions are going to be designed to meet your child's specific needs and help them reach their goals. All of our OT sessions are going to be motivating, engaging, and have activities that are meaningful and specific to your child. We understand that you don't have a sensory gym in your house more than likely, and that's okay. At Big Blue Canopy, we work hard to connect with families to figure out what their home setup looks like and what materials you might have within your home. And then we develop sensory diets and plans for you to implement these things at home so that your child doesn't master these skills just in the therapy environment, but that so you can carry these skills over at home. At Big Blue Canopy, our OTs take a very collaborative and holistic approach when treating your child. We don't use a one-size-fits-all model, and therefore, when making recommendations for therapy, your child's length of therapy and frequency in which they're seen each week will really be dependent on their needs and your family's schedule and availability. We collaborate with you to provide home exercise programs, visual schedules, sensory diets, so that you really feel like you can carry these skills that they're learning in therapy over into your home environment, in their school environment, and out in the community. Because it's great that they're successful at Big Blue Canopy, but really what we want is for them to be successful everywhere in their daily life. At Big Blue Canopy, we also really focus on the importance of providing resources and parent education so that our parents feel empowered and that they feel that they have more confidence in their abilities to advocate and teach their child these skills outside of our therapy environment. We also really strive to use an interdisciplinary approach, meaning that if your child receives multiple therapy services or counseling or intervention at school, whatever it may be, we try to get all members of your child's care team involved and communicating so that your child has the most comprehensive continuity of care possible. If you're interested in pursuing OT services for your child or seeing if they could benefit from occupational therapy, feel free to reach out to our office. Our office manager would be happy to talk to you more about what OT offers. If you have interest in speech therapy or physical therapy, she'd also be happy to go over any insurance questions you might have or schedule a time for you to come and take a look at our facilities to make sure that it's a good fit for you and your child. You can also reach out to your child's pediatrician and request an OT referral, and they can fax that to our office and get started on OT services pretty much almost immediately. Thank you so much for watching this video today. I hope you learned something new about pediatric occupational therapy. We look forward to supporting your child at Big Blue Canopy.